Has called on the aviation industry to investigate the circumstances surrounding that helicopter crash that killed 5 workers yesterday. While South Africa was learning of the death of Minister in the Presidency Jackson Mthembu, it emerged that the anaesthetist who assisted the emergency team with Mthembu's resuscitation, Dr Rudolph Mononyane, was killed in that rescue helicopter crash. Dr Mononyane, as well as Dr Siyabonga Mahlangu, nurse Mpho Xaba, Paramedic Sinjin Joshua Farrance and pilot Mark Stoxreiter were travelling in the hospital in the helicopter to KwaZulu-Natal as a response team for another critically ill patient. The Netcare CEO and group says they are profoundly saddened by the passing of 5 valued colleagues who died tragically in the line of duty. To discuss, we're now joined by the former president of the Health Professions Council of South Africa, Dr Kgosi Letlape. Doctor, thank you for being with us. Perhaps you would like to pay tribute to that medical team, the pilot and the medics who lost their lives whilst on the way to try and save a patient.
Yeah, this is a very sad day for the country and for the medical fraternity. Our condolences to the families. We've lost 5 scarce skills that are much needed in our country.
This is an aviation accident, but do you agree we have to know the details here, because rescue missions into other countries, patients being transported often by Netcare and other helicopters, this is important for the medical fraternity.
Yes, it is critical, and thankfully this type of incidents are rare, and we hope that the aviation industry will, in the usual impeccable manner, do a thorough investigation to ensure that a thing like this should not happen again.
Can you tell us anything more about the anaesthetist who actually tried to help Jackson Mthembu, then got onto this helicopter, changed his plans to try and help another patient? Anything about the others that were lost in this tragic accident?
Well, the anaesthetist is a young, dedicated professional who has done a lot of anesthetics for even doctors that are in the, many doctors that are in the private sector. And, he was a mentor to my own anesthetist, and he'll be sorely missed. When it comes to Dr. Mahlangu, the cardiothoracic surgeon, it's really a scarce skill. Even though we talk in general about medical doctors and the medical health professionals being scarce, cardiothoracic surgeons are actually quite scarce in our country. We're not producing nearly enough to meet the needs of the nation, and it is a very sad loss. The specialized nursing skills of the nurse that was lost are skills that we don't have in abundance. The paramedic was an excellent professional, and I would also hope that the helicopter that was the pilot of the helicopter was also a scarce skill. Yeah. So this is truly a setback in terms of healthcare personnel in our country, and it's a sad day for emergency services.
So sad. Like you say, they're incredibly skilled, and the doctors and that nurse would have landed up mentoring other young professionals coming through.
Oh yes, and I mean, they were in a unit that is a critical unit in terms of cardiothoracic work at the Mill Park Hospital. And, we having difficult times. We're losing too many colleagues to COVID, to other illnesses. And this is a COVID-related incident, since they were going to attend to a patient that was battling COVID. And we all need to pull together and hope that we overcome this pandemic.
Yeah. Doctor, finally, this couldn't have come at a worse time, when so many doctors, nurses, no colleagues who have passed away, when everybody is under incredible pressure. Surely this will weigh heavily on their colleagues as well.
This will weigh heavily, particularly that these were young doctors. As you know, most of the senior doctors who have comorbidities are particularly vulnerable to COVID. So we lost young, healthy healthcare professionals in the prime of their careers. This is a very sad day for all of us.
All right, thank you very much. That was the former president of the Health Professions Council of South Africa, Dr Kgosi Letlape.